2 years ago, our organisation conducted a survey through a large part of the sector. Small, medium and large providers from both private and non-profit were asked, what are your greatest challenges? Everyone said workforce. How do we attract and retain? How do we engage? Education, both RTO delivered and mandatory training. Technology used by workers, technology to manage workers. Workforce impacts everything that is valued most highly in this sector. What it showed was that workforce was the greatest single risk in the sector. So it really needed to receive much more attention than merely being a 2-hour breakout session at an annual conference. Unlike the peak bodies who have a wider industry focus, we really needed a group whose sole focus was workforce. We also saw that attitudes needed to change in the sector because though many providers spent money on customer or resident management technology, many providers did not spend equivalent sums on workforce management technology. 50% of the industry still have paper-based personnel records. From all of this, 3 key areas were identified that the sector had to get on top of as quickly as possible. There were other follow-on challenges that also need addressing, but these were the big 3. A team was put together, and I'm proud to say that they have completed these 3 initial projects and that all 3 are now available for use by the sector to assist you in lowering risk, saving time and costs. A national workforce tracking system, workforce accreditation standards, and a universal data exchange platform. A workforce tracker, workforce standards, data exchange. A workforce tracker, workforce standards, data exchange. Though they're 3 different systems, they all work together to underpin a new professional association for anyone who works in the aged community and disability space. Welcome to ACDN, the Support Workers Association. ACDN was designed to reinvent workforce management and workforce accreditation in this sector. We have some major challenges in this space with multiple stakeholders, including providers and workers, peak bodies and unions, service vendors, as well as the government, each with their own agenda and priorities. So ACDN has to pull all of these varied stakeholders together to change the workforce management, workforce accreditation conversation, because the current processes are no longer working. That's why the workforce is our greatest challenge. So the team at ACDN went to work on how we change the workforce conversation in this sector. We knew that to achieve cut-through, we needed to design something very special, starting with revolutionary connectivity. We are operating with cutting-edge technology, open API connectors that allow sharing of data in real time, single sign-on and automation of common HR functionality as standard. This is 2017, and all of this functionality is available for you if you ask. But why is connectivity one of the keys to ACDN? Well, for starters, your staff work for multiple employers at the same time, yet you are blind to what they are doing outside of your organisation, for both good and bad things. Imagine if you could see what your workers do outside of your home. The other key reason is though you probably have a variety of technology platforms, most of them probably cannot share data between each other, certainly not in real time. So you are needing to double enter data. Please note, CSV file download and upload is not an acceptable data exchange method in 2017. You also probably cannot combine data from different sources to make helpful business intelligence. And so you are exposing your organisation to unnecessary risk, as well as costs. In 2017, you should be able to import a new employee's personnel record into your HR system. That in turn automatically sets them up in payroll, followed by rostering. All of this technology is all available right now. So we designed CareHQ to underpin that association. In fact, CareHQ has proved so popular and revolutionary in its functionality that other compliance-driven industries with a mobile workforce, including healthcare, mining, construction, oil and gas, childcare, and the transport industry have come asking for a version for their sectors. So we had to set up a non-aged care version called Sure Comply to cope with the demand. CareHQ connects all of your workers to you in real time for compliance, communication, and multiple other benefits that make your operation run smoother. Internally, CareHQ uses API gateways to connect your recruitment platform to your HR platform, to your payroll, and to your rostering, and so on, creating a single source of truth, stopping double entry of data, lowering manual data entry errors. The same API gateways allow you to talk to the rest of the industry. See what mandatory training your staff have already completed this year at their other employers. Check before hiring someone where they have worked before and for how long. Please note, privacy has been built into everything. Obviously, we could not work across so many sectors and employers if compliance with the Australian Privacy Act was not the very bedrock of this system. The API gateway also collects verified employment, education, and compliance information, building a record of verified information about each of your workers, not just what they told you in their CV. And probably most powerful of all, the connectivity gives you the flexibility to plug and play various technology to see what works best for your organization, allowing you to build a best-of-breed network. None of us know what the sector will look like in 2 years, let alone 10 years. So why would you lock yourself into an expensive technology system that cannot evolve with you? So the technology is there. Now we need an agnostic organization to securely house the data on behalf of all of us members of this industry. So we created a new professional association with a singular focus on workforce matters, managed by the industry, for the industry. In only 25 years, aged care has moved from a cottage industry to a professional sector, community care and disability support in even shorter time frames. When industries professionalise, the people in that industry, as well as the community at large, expect more from the people that work in it. Therefore, the industry creates a professional association to codify the expectations of how the members of the industry should act, as well as giving mechanisms to support them in doing so. The AMA, CPA, the Law Society, and Engineers Australia are good examples of the industry building a professional association for its members. They are not government managed or a registration system like AHPRA. They are accreditation bodies with workforce accreditation standards designed and managed by the members of the industry. For example, CPA. You can work with just an accounting degree, but the industry blocks you from working in roles above a certain level. In order to work in those roles, the industry decrees that you must be a CPA or CA. The other associations act in a similar way. As I said, all of them are by the industry and for the industry. Well, now it's time for our industry. So we gathered a group of well-known, innovative, pushing the boundary types from across the sector, supported by experienced advisors in industry associations and law, and created ACDN, the Support Workers Association. Long-term sustainability and true governance can only be achieved by an independent corporate structure, an association. So though ACDN was built within a company structure, it is moving into a non-profit association as we speak. We have spoken to most of the interested parties, including all of the peak bodies, and they support this initiative. We are in discussion with government to get formal recognition, if not adoption, of the workforce accreditation standards. We've brought together a team of experienced operators from across the industry as advisors, and we're searching for the first CEO of the association. So we have the technology and we have the structure to hold everything. But in order for it to be adopted across the industry by all parties, it needs to be workable in our industry, intuitive to use. So it must provide genuine benefits to all parties, such as being easy to use, easy to onboard, easy to deploy. Flexibility of being used on a smartphone as much as a desktop computer. No more CSV upload download crap. The system needs to be able to provide real-time data exchange with automation and the convenience of single sign-on. If your platforms don't offer that functionality, you really should have a hard conversation with your suppliers. We went all out on using cutting-edge technology. For example, the smartphone app for an individual can create a QR code on the screen. They can use this to clock on and off, formally accept a job offer, and multiple other uses. The manager's app can read QR codes, so when the job offer has been accepted, they can settle the privacy connection between the individual and the new employer then and there on the spot. They can import their entire HR record on the spot. Cut straight to what you need to do whilst the person is sitting in front of you. It all starts now. Welcome to ACDN. For more information and to arrange a real-time demonstration of the platform, please contact Michael Marr at ACDN on 0416 245 981 or Michael M at agedcaredn.com.au.